Parents, everybody listen up. In this morning's Health Watch, we're separating fact from fiction when it comes to the H1N1 virus. With schools getting ready to open and flu season quickly approaching, we'll review some basic facts with our Dr. Jennifer Ashton. Good morning again.
Good morning, Maggie.
Here are some things that we hear about the swine flu. Let's see if they're fact or fiction. Number one, the H1N1 flu vaccine, which is being recommended now for everyone, will give me the flu.
Definitely fiction, Maggie. This is a big misconception. People always say they took the vaccine, they got sick. There is no live virus contained in this vaccine or the seasonal influenza vaccine. So when people do get sick, likely just a coincidence. Definitely fiction.
Number two, wearing a mask will protect me from the H1N1 flu. Everybody was advocating that when we were first learning about this flu.
Right, also fiction, Maggie.
Really?
In
Not
fact,
true.
the CDC only recommends the use of those masks under very specific circumstances. Actually, they're more for the protection of others if you yourself are sick in a selfless manner. Once they get moistened through our respiration and saliva, they become ineffective. Definitely false.
You can still get the flu from someone wearing a mask?
Yeah, I mean, you know, again, it doesn't completely form an airtight seal around the mouth, so it's not 100%.
All right, next, hand sanitizer is as effective as washing my hands.
Believe it or not, this is true.
I believe it.
Now, you have to wash your hands correctly. You have to use really warm or hot water at least 20 seconds or longer. You have to get all of your hands wet. And then, of course, when you go to turn off the faucet, you can't recontaminate your hands. But the alcohol-based hand sanitizers are also very effective.
All right, fact or fiction. I'm sneezing, I have a sore throat and a cough, so I must have H1N1.
No, definitely fiction. And in fact, when people get a regular cold caused by the cold virus, they can feel pretty bad. But 93% of people who have been confirmed to have H1N1 had fever. 83% also had cough. If you have true influenza, you know it. Most of the time, it's not subtle.
And the last one, if the rapid flu test comes back negative, that means that I do not have H1N1 flu.
Also false and fiction, Maggie.
Explain what the rapid flu test
There
is.
can be rapid tests done in urgent care settings, and they are not as reliable as the DNA or PCR testing for influenza. They're only accurate about 50% of the time. So again, you have to use the overall clinical scenario judgment, and if you're really suspicious, go back and get retested.
Dr. Jennifer Ashton, thank you so
bet,
much.
Maggie.